Welcome to this explainer. Look, if you're a prospective student eyeing the healthcare sector right now, you probably already know there is this massive gap between just reading about a medical procedure in a textbook and actually performing it in a high-stakes clinical setting. Today, we're going to unpack exactly how the Department of Medical Laboratory Technology at the KMU Institute of Health Sciences, or KMU IHS in Islamabad, is completely flipping that script. We're diving into their unique academic model that takes theoretical concepts and turns them directly into real-world clinical practice. It's exactly why this program is becoming the premier choice for ambitious freshers.
So let me ask you something directly. Are you ready to become the literal backbone of modern healthcare? Really think about it. Do you want a career where you're just, sitting passively in a classroom for 4 years? Or do you want a dynamic, hands-on journey where you're actively shaping patient care from day one? The reality is, modern diagnostic medicine absolutely relies on the precise, highly skilled work of medical laboratory technologists. Without them, evidence-based clinical decisions simply do not happen. Period.
And that exact reality is what drives the core mission over at KMU IHS. Their documented goal is, and I quote, producing highly competent, ethically grounded, and practice-ready medical laboratory technologists capable of meeting the evolving demands of modern healthcare systems. The key phrase there is absolutely practice-ready. They aren't just trying to get you to pass a written exam. Their whole vibe, their overarching commitment is forging confident, industry-ready professionals who can step into literally any modern laboratory and immediately start making a difference.
The contrast here is actually pretty striking. In a typical traditional learning environment, you might spend years staring at diagrams of cellular structures or reading about chemical assays long before you ever touch a real patient sample. Well, the KMU IHS model shatters that passive approach. They've built this incredible experiential learning model that focuses heavily on active, real-world clinical immersion. And they're doing this at one of the country's top tertiary care healthcare institutions, the Pakistan Institute of Medical Sciences, or PIMS, right in Islamabad.
Now, this whole setup is built on a very specific blueprint. KMU IHS has a formal Memorandum of Understanding with PIMS. That might sound a bit formal, but what it really means is this isn't just some casual visiting arrangement. It's a structured, strategic, academic, and clinical partnership. For you as a student, it guarantees a dynamic platform for professional development that completely bridges the gap between classroom instruction and real-world clinical practice. You get to observe, participate, and progressively perform diagnostic procedures, all under the watchful eye of seasoned experts.
So, what exactly are you going to be doing? Well, your clinical rotations at PIMS give you comprehensive exposure across all the core diagnostic disciplines. We're talking intense, action-oriented mastery in hematology and hemostasis, clinical biochemistry, diagnostic microbiology, histopathology and cytology, and blood bank and transfusion medicine. You're not just getting boxed into one tiny niche. You are being trained to understand the full, entire spectrum of diagnostic laboratory medicine. Let's take a look at what this actually looks like in action.
When you're in the clinical microscopy rotations, you are physically evaluating cellular morphology. You experience a real transition from guided mentorship where an expert helps fine-tune your microscopic focus, straight through to confident, independent analysis. Students learn systematic microscopic examination, they perform differential leukocyte counts, and they learn to spot abnormal cellular morphology. You'll be using Neubauer hemocytometers and learning exactly how to correlate what's under that lens with real, actual clinical conditions. It's pretty amazing to see it all click.
Then, over in the diagnostic microbiology rotation, you definitely don't just stand around observing. Students are actively labeling and inoculating culture plates and evaluating microbial growth. You get introduced to rigorous biosafety principles and aseptic practices right off the bat. You're processing clinical specimens, doing gram staining, and interpreting culture reports and antimicrobial susceptibility testing. You even dive into advanced stuff like TB gold testing for tuberculosis. This is where you learn the incredibly vital role of infection control and antimicrobial stewardship, completely firsthand.
Of course, behind all of this is an intense need for focus, because precision is absolutely everything in this field. You'll find yourself completely immersed in sample preparation. The training heavily emphasizes strict good laboratory practices, proper micropipette handling, precise volume measurement, and the absolute prevention of contamination. These foundational manual skills are so critical. You really have to develop that technical accuracy before you can rely on the automated systems, and KMU IHS makes absolutely sure you master these techniques under direct supervision. But let's be real, modern laboratories are highly automated, and your training will be too. You'll be learning to operate state-of-the-art automated clinical chemistry analyzers, like chemiluminescent immunoassay systems, as well as conducting rapid diagnostic tests. This clinical biochemistry rotation takes you through the entire pathway, everything from phlebotomy and preventing pre-analytical errors, all the way to interpreting the endpoint and kinetic assays that ultimately drive those critical, evidence-based clinical decisions. As outlined in the curriculum, this level of exposure is incredibly comprehensive. In hematology, you aren't just learning how to run a complete blood count. You're learning the analyzer principles, workflow management, and the really crucial daily quality control procedures. In clinical biochemistry, you handle everything from routine processing to urgent stat tests. You essentially learn how to prioritize lab workflows to ensure timely reporting, which, as you can imagine, is a total game changer for patient management.
Furthermore, the program mandates extensive practical learning in highly specialized disciplines. In histopathology and cytology, you're gaining hands-on experience with tissue processing, H&E staining, and Pap smear preparation, which are absolutely vital for cancer screening and early disease detection. And then in the blood bank rotation, you're conducting ABO and RH blood grouping, direct and indirect Coombs testing, and cross-matching to guarantee safe transfusion practices. The sheer breadth of this curriculum is truly designed to make you an indispensable asset to any medical team.
Now, stepping into a massive hospital like PIMS might sound a bit overwhelming, but this journey is safely guided. Enter the MLT coordinator, Mr. Mohammed Shoaib, whose role is absolutely pivotal here. He provides proactive academic oversight, continuously monitoring student engagement, competency acquisition, and professional conduct. Through regular site visits and coordination with hospital supervisors, he ensures that your clinical placement perfectly aligns with the high standards of the curriculum. You're in really good hands. And that support goes even deeper on a day-to-day basis. This is a very distinctive feature of the KMU IHS model. They provide a dedicated clinical instructor on site at PIMS. For instance, Mr. Mohammed Kamran facilitates the daily practical training. He acts as the essential bridge between your academic learning and its real-world clinical application. He provides daily supervision, practical demonstrations, individualized mentoring, and continuous competency assessments. You are never left to just passively observe. You're guided into active participation every single day.
But hey, a successful career requires a lot more than just knowing your way around pipettes and microscopes. This rotation is explicitly designed to build your professional growth way beyond just technical skills. By working alongside pathologists, laboratory scientists, and other healthcare professionals, you develop vital soft skills. You learn professional ethics, workplace discipline, effective communication, teamwork, and critical problem solving. You learn how to manage your time under pressure, and you learn the absolute importance of patient confidentiality. We also can't forget the behind-the-scenes mastery that literally keeps a modern hospital running. KMU IHS ensures you are trained in digital systems, specifically Laboratory Information Systems, or LIS for short. You learn barcode-based specimen identification, electronic result entry, and data management. Crucially, you're also deeply trained in quality assurance and laboratory accreditation practices. You'll understand internal quality control, equipment calibration, and the strict standard operating procedures that guarantee reliable patient safety.
When you put all of these elements together, the partnership with PIMS, the incredible breadth of diagnostic disciplines, the dedicated on-site mentorship, and the focus on both technical and professional growth, the impact is undeniable. The department's own assessment actually describes it perfectly as, quote, a highly enriching and transformative educational experience, and it shows. The enthusiasm and technical growth demonstrated by the students really prove that KMU IHS graduates step confidently out of the classroom